Good day everyone, I'm Ethan, moderator for this webinar. Welcome everyone for today's webinar, HIPAA and Patient Access of Information, Primary Enforcement Focus for HHS. I would now like to introduce our presenter for today, Jim Sheldon Dean. Jim Sheldon Dean is the founder and director of compliance services at Lewis Creek Systems LLC. He is a frequent speaker regarding HIPAA. Sheldon Dean has more than 2 decades of experience specializing in HIPAA compliance, 4 decades of experience in policy analysis and implementation, business process analysis, information systems, and software development. I would now like to hand over the floor to the speaker. Over to you, Jim.
Thank you very much, and welcome everybody to our session today looking at patient access of information. This is indeed a primary enforcement focus for our friends at the Department of Health and Human Services. So you want to make sure you're prepared to deal with any kinds of access requests and what's necessary to do what's appropriate for individual access rights. So we'll be looking at what are the patient rights for access of health information under HIPAA. And there's some guidance that's out there about providing access, as well as some new proposed changes to the access right. Anyway, we'll be discussing how to handle patient access. And related to that is communications of protected health information, including email and texting. There's certain things you need to keep in mind when you're communicating electronically when it comes to email and texting and protected health information. Now, what we're talking about today is the HIPAA privacy, security, and breach notification rules. Privacy rule is all about those rights and those controls on the organization. The security rule works with all the electronic information to give you the rules to think about, well, how do we protect this electronic stuff? Okay, so there's 3 kinds of communication, 3 kinds of flows of information that you need to think about when it comes to the security rule. Now, breach notification is a new kid on the block. It's only been around for only a dozen years now. It does require that anything that's reportable is reported to both the individuals who are affected and also to Health and Human Services. To the accounting of disclosures is required by the HITECH Act. The HITECH Act called for some changes to the rules on accounting of disclosures. And so the proposed changes that they're talking about for the privacy rule, a lot of those codify what that guidance has been, particularly the 2016 guidance. Now, when it comes to individual access of health information, the basic thing is you have to have a process for the individual to request access to their information at no cost. And understand that this would not include things like your internal staff review document. So the idea is, yes, the EHR's portal is great, but make sure you're ready to handle requests for information that might not be available through that portal. Make sure if it's outside the EHR, the individuals still have the ability to have access to it. Or information that might be compiled for various legal proceedings, some kind of administrative action, criminal, civil, whatever. And that's just the information that's been compiled for those purposes. Now, when it comes to denying access, there are some unreviewable grounds for denial. Those unreviewable grounds. Now, when it comes to a timely action, and 164.524B, we get into you have to permit requests for access. And when it comes to communications, there's a whole bunch of things to consider when you're looking at access and individual preferences. Now, all the 164.524 are the access sections. Now, when it comes to providing access, the individual might also be just as happy with a summary of the information. So you can provide a summary if the individual would prefer that. They have to agree to that. So there's more on denial of access and documentation. The thing is, when it comes to denial of access is, if some information is excluded, there's some limitations on liability for compliance for providing access. The business associate is liable for providing access in terms of the form and format and time and manner of access, whereas the covered entity is responsible for liability and compliance with the. There's some guidance on the business associate liability that came out in May of 2019. It covers a number of points. So basically, HHS announced changes in the enforcement. So what they say is, when it comes to the costs and releases of the individual and third parties, individuals still have a right to get copies of records themselves, paper or electronically, sent to them directly, with the cost limited to the individual access request fee. You can require that there be a written request, but you can also offer an electronic method. So you need to know who's asking for information and make sure it's a real request. So you can't require a request to be in person only, or by web only, or by mail only. That just doesn't cut it. That's being too burdensome, shall we say. When it comes to providing and denying access, you have to provide it in the form or format requested if it's readily producible. Okay. Timely within 15 days, within 30 days with a 30-day expansion. So now we have a number of questions and answers where they were in the 2016 guidance. The fees can be set by the actual or the average costs for a type of request. So if you know that somebody's asking you for a certain kind of information. So speaking of authorization, keep in mind now, access does not require authorization. They are not the same thing. Do not use the same form that you would use for an authorization. So when it comes to HIPAA considerations and communication, the security rule requires you to consider encryption of communications. It's an addressable specification. Now, under the security rule, it doesn't say you have to encrypt all communications. So when it comes to patient communications, what's permissible? You want to do what the patient wants. You want to meet the HIPAA requirements, accommodate whatever you reasonably can, keeping in mind that patient access is a high priority at HHS, okay? When it comes to communication with your family and friends of patients, that's really one of the areas where there's lots of sort of, other sort of realistic considerations that come into play here. The privacy rule does allow providers or health plans to share information with with the patient's family or friends. But when it comes to professional communications with health information, there's no excuses. Those things must be protected. Now, when it comes to communication with patients, though, you want to be flexible, so you want to be able to give them a secure solution. So email texting, basically, these are insecure technologies, okay? They're not secured by default, never were from the beginning, were never designed to be used the way they are. Many people would prefer texting to email or telephone because it's a great way to communicate short messages, great for schedule changes, it's great for quick communications, could be a lot more appropriate than an email or a phone call. When it comes to plain texting, there's things that it's got privacy issues, medical records issues, patient safety issues. I mean, you don't really know what's going to go wrong with texting in the future. You have to do your best to meet patient preferences, but we'll find out, how bad texting is somewhere down the line when people publish a book of everybody's text messages. There are some secure texting solutions out there for business use with health information. So the idea is you really need to have a secure communications platform. Smartphones is really how people communicate these days. There's just no getting around that. So you want to be able to have easy to use tools that give you a comprehensive platform. Okay, and what they said, the problem was when people had cell phones way back in 1991, you had to pay for every message and pay for every voice call. And when it comes to communications for healthcare purposes, these are allowed without a HIPAA authorization, okay? So if you want to be able to have communications with your patients for healthcare purposes, things like checkup reminders. So can you text appointment reminders? Yes, you can, so long as you have a consent or a TCPA. When it comes to calculating and evaluating the risks in electronic PHI, you're talking about sharing the information with the individuals that might get exposed. You need to think in terms of what's the impact and likelihood. How bad would it be if the information got out there? So you want to make sure you have some kind of policy in place for how you would be able to use insecure communications with patients. So you want to manage the access of records properly because this is a key issue, okay? This is one of only two circumstances where the PHI must be released. The way the penalties work out is if you do your homework, you got your reasonable diligence you've done, and still something goes wrong, well, that can start at $114. It can go up beyond that as well. So now what is a breach, okay? So a breach is any acquisition, access, use, or disclosure in violation of the privacy rule. It's a compromise. It's in a number of places, it's defined as a loss of control or a violation of security policy that may result in exposure, corruption, or loss of information. So information blocking is the number one enforcement topic at HHS, and it obviously has to do with the access rights. But we also have new rules that are going into place to facilitate exchange of health information. So now the information blocking penalties, when it comes to the individual access rules, there's a lot of wide variety of violation types that we're talking about when it comes to. Now when it comes to telemedicine, we've talked about the security rules some, but telemedicine is one of these areas where when it comes to communications with patients, all right? Now when it comes to telemedicine, HIPAA, and COVID-19, now when it comes to HIPAA and enforcement, and when it comes to HIPAA safe harbor law, the way this fits in is make sure that you have the ability to, what you want to do is, the safe harbor law incentivizes having good practices, okay? You have to do a good job with security. But you have to be prepared to deal with new technologies because we have these new technologies coming along anyway. And some of this involves individual controls of what information they've gotten, where it's coming from and going to. And the thing is, we have these new technologies that are coming along that we have to make sure we address. So where do we start? You have to review your procedures for providing individual access. Make sure you do it appropriately. Make sure you look at patient and professional communications as two separate things. So your to-do list is don't be denial because willful neglect costs more than compliance. That's the first thing. Well, I just want to thank everybody for listening. It's been my pleasure to talk with you today about HIPAA compliance and individual access. It is one of the key areas that you want to make sure you're doing appropriately so that you don't get in trouble with the Department of Health and Human Services. So again, thanks for listening, and please enjoy the remainder of your day.
Great. So everyone, that was a wonderful webinar. Well, have a great day. You all may disconnect now. Thank you.